Hello and welcome. My name is David Amphlett. I'm a clinical senior lecturer and honorary consultant in critical care at Imperial College London and co-investigator on the SepTiC trial and the chief investigator of the FLIP SepTiC embedded mechanistic study. In this video, I'm going to outline the sampling process that will take place within the SepTiC trial.
The first thing that we'll describe is what you'll need to collect the samples. For all patients that are randomised into the fluid and diagnostic domains, you will receive a sampling pack. The pack contains the following: a Royal Mail safe box, a pre-addressed label, an absorbent pad, a grip seal bag, and a pathoseal bag. You'll also receive the following tubes: a PaxGene tube, SST gold top serum tube, a small 5 ml purple top EDTA tube, some barcoded sample labels in white, some coloured ID labels, and a sample shipment form. For those patients who are randomised to receive the PCR diagnostic, you will also require a 10 ml purple top EDTA tube. These will be sent to you separately, so it's important that if your patient's in this arm of the trial, that you collect one of these prior to sample collection. Once you've assembled all of the equipment, it's time to collect the samples. If a sample has been drawn from an indwelling line, the first thing to do is to take 5 ml of blood for discard. Following this, fill the 5 ml purple top EDTA tube, then the gold top SST serum tube, followed by the PaxGene tube, and then only if the patient is to receive the PCR diagnostic test, you should fill the purple top 10 ml EDTA tube. Once your tubes have been filled, it's important that they are all completely filled. They need to be inverted. This should be done 10 times per tube. Once the tubes are full and have been mixed, it's time to put on the labels. You'll have a strip of barcoded identification labels in white. These need to be put on the tubes in the following order. The label D, should go on the small EDTA tube. The one with the suffix S goes on the yellow top serum tube. The one ending in R is for RNA Pax tube. And then if you've sent it or need to send it, the label ending in T goes on the large purple top tube. If this sample is not being sent, this label can be discarded. In all cases, labels should be put on in a longitudinal orientation. You will find that you're left with 3 labels, labelled R1, R2 and R3. It's important that these are retained because you will need these if your patient becomes randomised into the GM-CSF domain of the trial. In order to get ready to post the samples, they should be wrapped in the white absorbent pad that came in your pack. Once this has been done, they can be placed in the small, clear, sealable bag, which should then be sealed. That bag is then placed into the pathoseal biohazard bag, which should be sealed following the instructions that are printed on the bag itself. Once the samples have been collected and placed in the bags, they're ready to post. The first thing that needs to be done prior to posting is to complete the sample shipment form. This needs to be completed with the date the samples were taken and shipped. If not already pre-filled, the site name and site number. The details of the person at your site who is to receive the result of the PCR test, including their name, telephone number and email address. And then the study identification number for the participant, as well as their month and year of birth. Once this has been completed, you will need the strip of coloured non-barcoded labels. And one label should be placed on the form for every sample that has been collected. For the first sample collection, this will leave you with 3 unused labels, again labelled R1, R2 and R3. As with the barcoded labels, these should be retained in case your patient is randomised into the GM-CSF domain of the trial. For each sample that's been collected, the date that the sample was taken should also be recorded, along with the type of sample that is being sent back. Don't forget the form is two-sided in case you need space for other samples, and the back should also be completed with the patient identification and the month and year of their birth. The 2 boxes at the bottom are for the central trial team, but this form includes extra space in case there are more samples to be returned. Once the form has been completed, the safe box can be assembled following the instructions on the back. This can then be filled with the samples within their protective plastic bags, which should be ensured are sealed, and the sample shipment form. When the box has been filled, you can take the sample shipment label, which will be pre-labelled with our destination address, but you need to complete your own address in the white box at the top. Once this is done, this label can be used to seal the safe box. Once the safe box is full and sealed, it can be taken to your local post box where it should be posted as soon as possible. If your patient is randomised into the GM-CSF domain of the trial, they will need some additional samples collecting. Up to 3 more samples will need to be sent, and these will all be collected into PaxGene tubes, which will have been sent separately to your initial sample collection pack. The first sample should be taken after randomisation but before the first dose of the drug is given, and this needs to be labelled with the barcoded sticker that ends R1. The second sample will be taken on day 3 after randomisation and will be labelled as R2, and the final sample is taken on day 5 after randomisation and is labelled as R3. For each sample that has been collected, it will need to be labelled with the barcoded sticker which you'll have retained from your initial sample collection. A new sample shipment form will need to be completed with the relevant coloured sticker attached, and the samples will need to be packaged up as previously described and placed in a new safe box along with the sample shipment form and posted as soon as possible back to the central team. If you have any questions about the sampling protocol in the SepTiC and FlipSeptic trials, please get in contact with the central trial team at septic@imperial.ac.uk.